My boss where I've launched my YouTube channel. Just go into YouTube and click Jen and type in Jen Med, and I've done my first video for YouTube. You know, normally I just probably put some of my Facebook videos long ago on my YouTube. I am now doing specific videos just for YouTube. So now you're gonna get Dr. Jen on Facebook, and I do special shorter videos on YouTube. So my first video is on YouTube. Go to Jen Med, subscribe to that page, show me some love, show some support if you want to see me stay on air. Very good. All right, that was a lot. Whew. All right, so very good. Let's get into it tonight. Tonight we will be talking about the prostate. Daughter, may I get the book, please? Yes, so we will be talking about prostate. So are the men checking yet? The biology book. No, give me the other one. The one with the color picture. We will be talking about prostate. Prostate. Thank you. Yes, man. My boss web on YouTube. Go give me a little subscribe over there. Asanya, if you're online, can you post the link for me, please? Or if anybody on, you could just go into YouTube, go to Jen Med and just copy the link in the chat for me now, please. Please and thanks. All right, so tonight we're going to talk about prostate. And I know most men, them can't listen to the bag of talking, so I'm going to go fast. If most men are like my husband cannot deal with the bag of talking. So we have to go straight, right? So what is the prostate? Does anybody know about the prostate? What is the prostate? Anybody? Thank you. Thank you. Where is Sophia? Sophia always help me teach, you know. Sophia Murray, where are you? Miss you? Okay. So, the prostate is a gland which is only in men. There are some things that only men have, right? And this is one of those glands, right? So down by the genital area, right? You have, of course, you know, you have the penis, right? But in relation to the penis, you have the prostate gland. And we always hear about prostate cancer so much, but most men do not even know what is the prostate. Very good. May I get a ruler or a pen so I can highlight this? All right, so this is an old biology. Thank you, dear. This is an old biology book. So here you see the penis. Very good. This white thing is the bone, right? Behind the bone, your pubic bone. If I was wearing decent clothes, I would have stand up and show you. Behind the bone here, right? The bladder that keep your urine. In this blue, under the bladder here, is the prostate. Prostate. Right? Here, down here, testicle. In what we call the balls, right? And I think that's enough for us now. So let us get our bearings again. Men and women. Right? So, here we have, again, the bone, the pubic bone, the bladder, the prostate just under here, the penis, the testicle. Behind here would be what? Your rectum. It's not on this picture, but that is your tripe, your intestine, your colon. The last part of it, where shortly before the doodle is going to come out, your feces, whatever you want to call it. Yes, I break it down, right down to foundational level, that when I teach, all my children can understand all of this. Are we following? So you have to, there's a reason I'm explaining it on this basic level, because when the doctor going to tell you that need for the certain examination, you're going to wonder why. Let me see. Give me the other book, please. Let me see if the other book show the rectum a little better. Oh. You know, all right, this one show it a little better. All right, come again. So take 2. These are some old bio books. So come again. You can tell me. Everybody know the penis. Bladder. Prostate. The balls. Now we see some tubes. Let us try and see if we can figure out the tubes. So what tube you think is here running through the penis coming out there? Who want to take a wild guess? What tube you think is here running out through here? What is that tube? What is it carrying in it? So yes, that is the urethra. It is carrying what? Urine from the bladder. Very good. Are you following? Men, I hope you're paying attention now. All me I ask the men them for check in, them won't check in. My God. Is a man topic this, you know? Good. Now, if you notice where the urine tube runs, it runs right through the prostate from the bladder. See it there? So the urine tube runs right from the bladder through the prostate, then out to the penis. Very good. Now, I'm sure we follow that. Any questions so far? Very good. Thank you, Mitzi. Boy, Sophie, I'm going to miss you. I don't even know you. I'm a spirit tech to you so much. All right. So right here now, you see this little thing them draw looking like a flower? Let me go up in my ruler. It's good. That's a seminal vesicle, right? And that is very important in that fluid that's going to help with forming the, that's going to be in your semen. That sperm fluid. It's not the sperm per se, but that fluid that's going to be with the sperm to form your semen. And all of that also comes through here, the urethra, and come out here. So men, when you ejaculate or you come, or when you come, right, everything is going to be coming through this same tube. Where the sperm come from? Here. Up this tube. Come up so. See that now? Very good. Now if you look behind here, this is the rectum. This is the part, your anus, where the feces or your doo-doo or your poop would come through. So you see, this is your rectum. This is the front part, which would have the bone, the bladder, the prostate, the urine tube, which is the urethra, and the penis. Very good. Now, I took a little time to explain that because it helps you to understand why doctors do what they do with prostate. I tell you, I'm not staying long with you tonight on a Friday night. Good. So the prostate, where it is located is very important, because when the doctor has to examine you, they have to examine the back passage. We'll soon get to that. Let me leave that alone. Now, why I'm teaching on prostate is because Jamaica has one of the highest rates of prostate cancer in the world. In the world. In fact, of all the cancers in Jamaica, prostate is the highest cancer. More than colon, more than breast, right? More than lung. It is prostate is the #1 cancer in Jamaica. So that is what I want you to really think about. That it is very, very, very common. And as time goes by, realizing it's a cancer happening so often. The issue The issue with men is that they don't like to get checkup. They don't like to go to doctor. Even when they're feeling sick, they do not get checkup. And what tends to happen is that when they do finally reach the doctor, they tend to be very sick. They tend to be very sick. So the prostate makes that fluid that is gonna, when you come now, it's gonna squeeze and push out that semen, that seminal fluid, which has the sperm and all of that, right? So your prostate is very, very important, men. Now, when you're a younger man, it's very small. It's very small. But as you get older, it gets bigger in size, and that is normal. It's no biggie. But what tends to happen is that as you get older, it can get really, really large. And we call that condition what? BPH. Benign prostate hypertrophy. And that is a condition in which the prostate is just enlarged. So that gland that I just show you in the book there, so it just get big. Now, based on where it is now, let me and you reason now. Based on where it is and what run through it, what was that run through the prostate? The urine tube, the urethra. So when that prostate get big, what you think it causes? What symptoms you think it will cause? Think about what I just say. What symptoms do you think might occur when the prostate get big? Yes, the comments are coming in slow, so I can't even see them to keep up with the class. So when the prostate get big, all right, we're getting close, Narlene. The bladder, it can affect the bladder. Thank you, Miriam. You can retain urine. We in Jamaica call it stoppage of urine. Trickling urine. The stream is weak. You go frequently. You go at night time. After you pee, you still feel like you need to pee some more. Or after you pee and you think you finish, it's a dribble again. Right? So you start to have urinary symptoms to the point that it can completely block off, and your the bladder just getting big, and that sometimes these men have to rush to the doctor, rush to the hospital because the urine won't come out. Yes, the stream can be slow, very, very slow, because the urine tube runs through the prostate, and you see where it is. Yes, thank you. Very good. Very good. So you have an idea of the main symptoms it can cause. Let me see if you miss out any. No, I think we get it, you know, we get most of the symptoms. Pain if they can't get out the urine. Right, and they go frequent and mostly at nights, which can be so annoying. All through the day, them all right, and then nighttime, them have to be getting up. And so, when they have to get up so much times in the night, what happens? They don't get good rest. They can't sleep properly. You get me? So, it just becomes so annoying. The prostate enlargement usually starts when they're older, from about 60 or so, as they get older. And it's not really a big deal in terms of disease-wise. It's not something that will kill you per se. But it is, as I tell you, the biggest issue is that if it block up the urine and no urine won't come out, like if the muscles go into spasm and things like that, then you have issue. Then they might have to tell you about surgery and all of that. We'll soon touch on that. Very good. Okay, Karen. So you understand what I am saying. So how they generally treat this is with medications, right? So you've heard of drugs like Flomax or finasteride and drugs like that. And to be honest with you, those drugs tend to really work well for most people. And it's just one of those things that come with age, in terms of, you know, I mean, if you don't even get it when you're 60 or when you're 80, you know, it happens because as you get older, the prostate is just going to get bigger and bigger and bigger, and it just comes with the territory. But not all men have severe symptoms anyway. But it's nothing to be too alarmed about. What is another thing that can affect the prostate? Infection. You can get infection. You can get what is called a prostatitis, which is a bacterial infection. And you get a lot of pain, fever, chills, all of that. You know, and that can be confusing at times for the doctor, but there are ways that is easy to treat with just a long course of antibiotics. I don't want to spend too much time on these things. We want to get into the meat of the matter. So, are you clear with the prostate? We know where it is. We know the symptoms it causes. We understand, say, as men get older, chances are they're going to have prostate enlargement. It's nothing to be too worried about.